Hello everyone, this is Sakshi Sharma, a registered nurse. So today we are here to discuss about the components of NCLEX-RN. So guys, in my last video we discussed what actually the NCLEX is. So we discussed the CAT adaptability, how the NCLEX recognizes that you pass or you fail, what are the 4 components of NCLEX-RN. So just give it a review before watching this video, because in this video I am putting the reflection on the first component of NCLEX-RN, which is safe and effective care environment, and its 2 subcategories. So guys, if you're going to master your NCLEX-RN in first attempt, these contents should have a clear insight among you that what actually NCLEX covers and how the questions are designed in which formulated pattern. So let's get started. So first component which I would like to mention here today is safe and effective care environment. So safe and effective care environment consists of 2 subcategories, in which first category is management of care. In management of care, it comprises of 17 to 23% of chunk in your NCLEX-RN. So that's why I say that you should clear your horizons related to such content, because these subcategories will judge you that you are near the passing standard, below or above the passing standard. If you are above the passing standard, then you of course pass. If you are near or below the passing standard, then you unfortunately fail. If you fail the exam, you will know that they will give you a handoff report in which they will mention that how much you gained in safe and effective care environment and the other components. So today we will be discussing that what actually safe and effective care environment consists of and how the questions are designed. So our first component is management of care. In management of care, it includes providing and directing care that enhances the care delivery setting to protect clients and healthcare personnel. So guys, it's very clear cut that we are protecting and directing care to the patients, and the care is provided in such setting that it will protect clients and healthcare staff among any hazardous thing or situation which can happen. So here we would mention some topics which are included in your NCLEX-RN exam. In management of care, such topics are given consideration while planning your NCLEX-RN. Like computer will throw a list of questions. For example, if 70 to 23% of questions are coming in your exam, that means these topics can be covered while the computer throws a question on you. So first here is advanced care directives. I will make separate videos for these topics as well. So advanced directives means living will, proxy, medical power of attorney, something like that. If the patient is not able to take decisions on their behalf, for example, the cancer patient or a terminal ill patient, then who will be the proxy or who will be handling of the medical power of attorney based on the client? The other thing is advocacy, like advocating for the client, standing for your client. Assignment, delegation, supervision. So that means how we are delegating some assignments or tasks to UAP, to LPN. So such questions are they also play a major role in NCLEX-RN, especially delegation and supervision. So you should be accompanied with scope of practice of LPN, UAP. We will cover everything further. So this is just a starting. Other thing we have is case management. In case management, it will include questions like client needs equipment like oxygen saturation, the supplies for wound dressing. So how the case management will be performed. So such questions are designed in such manner in your NCLEX-RN. Other thing we have here is client rights. Like client can refuse the treatment if he didn't understand the procedure or if he's not sure about that. So he can refuse the treatment. Collaboration with interdisciplinary team, which means nurse should know how to collaborate with physical therapist, nutritionist, case manager, pharmacist. You should have a quality to collaborate with your healthcare team according to the client needs and desires. The other thing we have here is about your confidentiality. So confidentiality is also an important aspect which is covered in your NCLEX-RN. In confidentiality, we all know that we have studied every time that we have to be confidential about the client's information. We cannot share the information like in public elevators, cafeteria, something like that. Then we have is information security, continuity of care. In continuity of care, hand care reports, medical records, referrals, they are included. And then we have is establishing priorities. Establishing priorities means we will provide the care to the client according to the client acuity. Acuity means needs. So we have to establish pathophysiology. Like you should be concerned about the disease. What are the symptoms? What will be the treatment be? What was the causes? So then on that way we can establish priorities. We can see that what will be the treatment plan of the patient. So what are the desires of the patient? Right now, what should be focusing on the patient? Like what are the other things which we can include in the nursing care plan? Something like these questions can be designed in your RN. Informed consent. This is the favorite topic of NCLEX-RN, informed consent. Without an informed consent, a doctor cannot perform a procedure. So nurse can only be a witness to an informed consent. She cannot take the informed consent. Information technology. Information technology means logging into your account. Do not share your passwords or your account information with your healthcare staff. So these are some things. In this information technology, I would also like to mention like shredding of the documents properly. So we cannot just throw in garbage the patient list. And the other thing is, for example, if your coworker says, hey, I forgot my password. Can I use your Outlook email for just a second? No. We can say you can call information technology desk. They can support you with this. So never share your passwords because there are so many conflicts and things going around there. So we don't know if something happens unfortunate, then you will be blamed for that. Other thing here I would like to mention is legal rights and responsibilities of a client, of a nurse, like what the client have their legal rights, what the nurse responsibilities are there. So the questions are designed in that format. Performance or quality improvement. Performance or quality improvement means the nurse participates in performance improvement projects like appraisals, like what the nurse is doing best in. And referrals. In referrals, we can say we are referring the patient to respite care, social services, shelters. Example here can be, for example, a client is pregnant, so she delivered a baby girl and she doesn't do a job and she also experiences a domestic violence. So who will be the nurse referring the client to? So we can refer her to the social care worker because they deal with the financing problems for the client. So something like that, like your basic concepts should be included. So you know that these are the basic topics. They seem to be basic, but your critical concepts should be cleared and you should have a critical decision-making skills while answering your question. So these are some important points which should be considered. So now I would like to throw some questions on this so that we can discuss that how questions are performed. So here I have question which is based on client rights and informed consent. So here the question is, patient with diagnosis of cervical cancer is scheduled for hysterectomy but did not understand the procedure. What should the nurse do? So here we have 4 options. First option is ignore the situation, let patient sign the informed consent. Now see what question is asking you. Question is asking, patient with diagnosis of cervical cancer is scheduled for hysterectomy but did not understand about the procedure. Read this statement, but did not understand about the procedure. Now, what should the nurse do? So first option says, ignore the situation and let patient sign the informed consent. So you can be a witness in the informed consent, but can you ignore the situation as a nurse? Nurse should do best in her duties, what are her daily responsibilities. So she should perform her best. She should give her 100%. We cannot ignore the situation as we have to advocate for the client. B option says explain procedure to the client. So this is the doctor's responsibility. Can we as a nurse explain the procedure to the client, that what will be the treatment covering in it? What are the risks associated with the procedure? What will be the benefits? These are not our daily responsibilities. These are the doctor's responsibility. So this option is not a perfect match for this question as well. Next option we have, tell the healthcare provider that client does not understand the medical procedure. So advocate for the client. This seems to be a good option. So we will tell the healthcare provider that, hey doctor, the client with the cervical cancer who is scheduled for hysterectomy did not understand about the procedure. Can you explain the procedure to the client? So this sounds to be a good option. Like we are advocating for the client. And then when the doctor will explain the procedure, he or she can make up their mind that either they want to go for it or not. The other thing we have is tell the nursing supervisor. So guys, here this option can confuse some students, but here I would like to mention nursing supervisor is a nursing hierarchy which we always follow if there are discrepancies going among the co-workers, if there are any conflicts, if there is any scheduling problem, if something happens on the floor, like if there is a fall or something. But it is about the procedure. So we will go straightforwardly to the healthcare provider rather than to going to the nursing supervisor. So this is how we do the critical decision making skills while performing the question, like what question is exactly asking. So the hidden hint is given here, that did not understand about the procedure. This was a sample item. We will do one more. So here I have a question which is based on confidentiality of a client, which is also an important topic. So the question says, a nurse heard a co-worker talking about a patient in cafeteria. What should RN do in this situation? So first option is talk with nursing supervisor. Okay, we can talk with the nursing supervisor about this, that I heard two nurses talking about a patient. We can consider this. We will read the next options. Ignore the situation. As I already mentioned, we cannot ignore the situation. Like it should be given a concern. It should be addressed. C option, confront such situation with nurses. So confront means we will talk about this matter with the nurses who were discussing about the client in a cafeteria. It seems to be a good option. Last is tell the nursing regulatory body. So for such matter, like we cannot tell the nursing regulatory bodies, it's not our job to tell the nursing regulatory body about such matter. So first, the priority will be given to these two options. So if we have to decide among these two options, how we have to make our critical decision skills. Talk with nursing supervisor. We can, but first confrontation with those nurses who are talking about the client is necessary, because after confronting, if the nurses again talk about the client in a cafeteria or in a lifts, public lifts, or anywhere in the if anywhere in the floor, so then we can go to the nursing supervisor, understand the hierarchy. So first, confrontation with the nurses is mandatory. So we can talk this matter that, hey, this is not allowed, this is not ethical. We cannot talk about the patient in public halls or libraries or cafeteria or markets. So we can discuss this thing. But if again this issue happens, then we can go to the nursing supervisor. So in this question, the question is asking, what should RN first do in this situation? So first she will be doing confronting this situation with the nurses. So that's the correct option. So I hope this makes a clear concept in front of you, that how we are managing the video, like how we are performing the. So So guys, this was all about for today, which includes the management of care, the subcategory of safe and effective care environment. I know when we are preparing for NCLEX-RN, sometimes topics get heavy on our mind, so that's why I enlisted just this portion. So just concentrate that what is included in management of care, what are such topics, like what are these topics. We will be discussing these topics in detail in my further videos. I have just given you a basic ideology that what NCLEX actually cover is. So in my next video, we will be covering safety and infection control. I hope you like this video. Please like and share this video with your nursing peers and hope you enjoy this video.